Hey, welcome to the show. Whether you are new here or you're a longtime follower, this episode is a must listen. I thought I would do a bit of a recap so that you understand what perimenopause is, when it starts, and the key symptoms to look out for, as well as why this stage of life is so crucial. So let's get to it. Perimenopause is the transitional phase before menopause. Menopause occurs after 12 consecutive months without a menstrual period. And the average age is 51, but it can happen earlier or later depending on the woman because we are all unique. So, perimenopause can actually begin as early as your mid to late 30s. But most women start to notice symptoms or they become louder in their 40s. So, perimenopause is essentially when hormones start to fluctuate a lot, especially estrogen, which is your more stimulating hormone, and then progesterone, which is your more calming hormone. And these fluctuations can cause a wide range of symptoms. So, during this phase, your ovaries are gradually winding down. They no longer want to produce hormones. They're like, yeah, I'm done. I'm ready to retire. But unfortunately, it is not a linear process. Hormone levels can fluctuate wildly, day to day, creating symptoms that range from super annoying, like bloating, to downright life altering, like debilitating anxiety and depression. So, estrogen can be high one day and it can be low the next. And progesterone is a hormone that we do produce all month at low levels, but we get a peak after ovulation. However, in perimenopause, we're not ovulating regularly, if at all. So we're not making enough of this amazing hormone. So a lot of the symptoms that women experience in this stage of life are due to low progesterone. So while this hormonal roller coaster is a natural part of aging, it's not something that you just have to accept because it is a time when many women start to feel like they've lost control over their health and their well-being. And then it does increase risk of chronic diseases later on. And I'll get to that in a minute. So what are the symptoms or the common symptoms of perimenopause? And these are things that women are coming to me with and what I see and things that I actually experience myself. So mood swings and irritability. Those fluctuating hormones can affect your mental health. So you may have some really low moods where you're really sad, you're crying, you're more emotional, and you may have days or moments where you're really irritable and you're snapping at your kids, your husband, or your coworkers, and like everything annoys you, right? People breathing, people chewing, just outside noise. I know that was something for me it was like my mid to late 30s when I really started to experience symptoms and noise bothered me so much. I felt like I was losing my mind some days, but it's luckily gotten much better. All right. The other thing is sleep disturbances. You may have trouble falling asleep or staying asleep. And many women tell me that they wake up in the middle of the night and they're not able to fall back asleep. And that could be due to a number of things. Obviously, these hormone fluctuations, it could also be due to blood sugar dysregulation, or maybe you're getting hot flashes or night sweats, which is obviously another common symptom of perimenopause. And then because of that, a lot of women are dealing with fatigue. I hear this over and over again. Women are like, I feel so freaking tired. I have to take a nap in the afternoon, or they're reaching for certain stimulants like caffeine or sugar to give them a little jolt of energy to get through their day. And maybe you are sleeping okay at night, but you're still feeling fatigued. This is all very common. And you may also notice that you have low motivation and you just want to lay around. Some women say to me, Claudia, I want to implement a lot of the things that you're telling me, but I just don't have the motivation to do any of it. You're not lazy. This is all really normal for this stage of life. All right, the other common symptom is weight changes. Oh my goodness, so many women are dealing with weight struggles, whether they're gaining weight or they're just having a really hard time losing weight, especially around the midsection. Yeah. Again, super common, and it is definitely a byproduct of these fluctuating hormones. And then, of course, there's more hormones in the mix, like cortisol, which also play a really big role in your weight, as well as insulin. All right, then we have brain fog. Oh my gosh, this is a big one, right? A lot of women have trouble remembering things. They can't focus. Maybe you've actually been diagnosed with ADHD. And while that that diagnosis may feel like you have an answer, it's not addressing the hormone changes that are occurring. And full transparency, when I started to deal with perimenopause in my, again, it's like my mid to late 30s is when I really started to feel things, late 30s. I actually was thinking that I had ADD because I could not focus. I could not finish certain tasks. I would get so easily distracted. And then I felt like I was losing my mind. And I would sit there crying because I'm like, I don't understand. Like, why is my brain not working? That's what it felt like. And it wasn't ADD or ADHD. It was the hormone changes that were happening. And it has gotten so, so much better. All right, another symptom is vaginal dryness or changes in libido, and they often go hand in hand. But, these symptoms are often overlooked because they're kind of uncomfortable to talk about, right? You don't want to be telling people like, hey, my vagina's dry, even though I share that with the world. Or maybe you don't want to, talk about the fact that you're just not in the mood for sex and you don't want to, get busy with your partner. And that can take such a toll on your relationship and just how you feel. And you may feel guilty and, it affects your confidence and just connection with somebody that you love. It stinks. It really does. But this is something that is really common in this stage of life. So the other thing, and this I actually don't see as frequently, is changing periods or irregular periods. A lot of women will say, Claudia, I have all these other symptoms, but my periods are fine. So is it perimenopause? Yes, it still is, right? You don't have to have every single one of these symptoms, but these are some of the common ones. However, some women do continue to have regular periods for a while. And then when you're in like later stage perimenopause is when it starts to change for some women. My period was starting to change, and I have seen that with some clients, but the majority of women that come to us are dealing with all these other things that I just mentioned, right? The mood swings, the irritability, sleep disturbances, fatigue, weight changes, brain fog, changes in libido. And those things can all be really life altering, as you know. So the other not so obvious or common symptoms that a lot of women experience in perimenopause are hair loss, UTIs, so you're getting more frequent urinary tract infections. You may even notice changes in your body odor. We've had some clients tell us that. Digestive issues are a big one, like gas, constipation, acid reflux. Joint pain is another one. That was something that I dealt with, as well as heart palpitations, which of course can be really scary. So, if any of these symptoms resonate with you, know that you are not alone. Millions of women experience these changes, and understanding them and acknowledging that you are starting this transition is the first step to improving your health. And I know a lot of women hear the term perimenopause and they're like, oh my God, not me. I'm too young for that. Well, if you are in your mid 30s or above and you've got these symptoms, sorry to say, you're probably starting perimenopause, and you don't have to label it that necessarily if that doesn't resonate with you or feel comfortable to you. But just know that your hormones are starting to shift, right? You're starting to experience fluctuations and a decline in hormones because that's just what happens as we get older. But I want you to have hope and feel empowered that you can implement changes and start to feel better, right? Because that's what I want for you. I want you to feel better. The point of this podcast, the point of why I do this work is to educate you so that you're empowered and you can make informed decisions about your health. All right, so why is this stage crucial? Perimenopause is more than just a phase of annoying symptoms, as you're learning. It really is a critical window for your long-term health. The hormonal shifts that are happening during this time don't just affect how you feel day to day. They can impact your future risk of chronic diseases. As estrogen and progesterone levels fluctuate and eventually decline, your body undergoes changes that can increase your vulnerability to things like type 2 diabetes. So as you lose estrogen especially, it can affect how your body processes insulin. And that's going to make blood sugar regulation much more challenging. And then there's heart disease. That is the number one killer of women, and it's not talked about enough. But estrogen plays a protective role in heart health. And as your levels drop, your risk of high blood pressure, cholesterol imbalances, as well as cardiovascular disease rises. Then there's dementia. Emerging research links hormonal changes during perimenopause to brain health, including memory and cognitive function. Then there's osteoporosis, and estrogen and progesterone are critical for bone density. And when they decline, it can lead to bone loss and an increased risk of fractures. Lastly, cancers. While the risk does vary from person to person, certain cancers such as breast and uterine cancer can be influenced by the hormonal changes and, of course, lifestyle factors. So, by addressing your health now through lifestyle changes, stress management, targeted nutrition, advanced testing, and hormone support, you're not just improving your current quality of life, which is amazing, but you're also laying the foundation for healthier aging. So think of perimenopause or the symptoms that you're experiencing as your body's call for attention. It's like, hello, pay attention to me. You got to make some changes. So the choices that you make now will dramatically shape how you feel like 5 years from now, 10 years from now, and beyond. So this is why getting the right support during perimenopause really is so important. And with the right guidance, you can identify imbalances earlier on, you can reduce your risk, and you can create a plan that empowers you to thrive through this transition and, quite frankly, the rest of your life. So my program, the Perimenopause Method, is designed for women in their mid-30s up to mid-50s who are navigating the challenges of hormone fluctuations and hormone decline. This isn't a one-size-fits-all approach. It is truly personalized to meet your unique needs. And the reason why our clients get results is because we include advanced testing. So we go beyond the basics, and we use testing like hair tissue mineral analysis. Minerals are the spark plugs of life, and they are needed for so many functions in the body, including hormone production, metabolization of those hormones, and detoxification. Then we also utilize comprehensive blood work review from a functional health perspective. So this goes beyond just looking at the ranges that your doctor is paying attention to. And then we also utilize stool testing, if your budget allows, to uncover any other root causes like inflammation and imbalance of gut bacteria, gut infections, things like that. And that's going to help us pinpoint why you're experiencing some of the symptoms that you're dealing with. We also include transformative coaching. You receive guidance to optimize your nutrition, your sleep, your stress management, how to navigate the confusing world of hormone replacement therapy, if that is something you choose to look into and utilize, and much more. And then we give you ongoing support. You will never feel alone in this journey. Our community and our team are here to provide encouragement as well as accountability every step of the way. So whether you're struggling with fatigue, mood swings, sleep disruption, weight gain, or you're just feeling really disconnected from your body, the Perimenopause Method is available to help you feel empowered and in control of your health. So check out the link in my bio to learn more, or just send me an email, claudia@claudiapetrilli.com. I am more than happy to answer any questions you have, but please don't wait to prioritize your health, ladies. Whether you work with me or somebody else, it really is so important. All right, thank you so much for being here today. If you found this episode helpful, please share it with a friend, subscribe to the podcast, and leave a positive review. Your support helps more women discover the resources that they need during this crucial phase of life. All right, until next time. Hey, before you go, if you're resonating with this podcast and realize that your symptoms are anything but normal, my comprehensive program, the Perimenopause Method, may be a great fit for you. My team and I help women in their mid-30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and much more. We do this by utilizing advanced testing, a personalized plan tailored to you, women's health and hormones education, and ongoing support so you never feel alone and you get results. If you're ready to commit to your health and feel like yourself again, but even better, check out the link in the show notes to learn more about the Perimenopause Method. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.